In this video by deck plate we will understand the VA rating for rectum, anus, impairment of sphincter control, fistula in ano, hemorrhoids and Pruritus ani conditions. Disclaimer. This video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Rectum and anus conditions such as impairment of sphincter control, fistula in ano, hemorrhoids and Pruritus ani are often linked to military service due to strenuous physical activity, prolonged sitting, and stressful conditions. These factors can exacerbate or cause gastrointestinal issues, leading to chronic discomfort and significant impact on daily functioning, necessitating proper evaluation and compensation. In this video, we'll delve into the rectum and anus, exploring conditions like impaired sphincter control, fistula in ano, hemorrhoids, and Pruritus ani, along with their diagnostic codes and rating criteria. Rectum and anus, impairment of sphincter control, diagnostic code 7332. This condition involves weakened or damaged sphincter muscles in the rectum and anus, leading to issues like incontinence, difficulty controlling bowel movements, and potential leakage, significantly affecting daily life and hygiene. VA rating for loss of sphincter control. 100% rating. Complete loss of sphincter control, where incontinence or retention is unresponsive to a physician-prescribed bowel program. This condition requires surgical intervention, digital stimulation, medications beyond laxatives, and a special diet. Alternatively, it involves incontinence to solids and/or liquids 2 or more times per day, necessitating pad changes 2 or more times daily. 60% rating. Significant loss of sphincter control, with incontinence or retention partially managed by a physician-prescribed bowel program. This situation demands surgical intervention, digital stimulation, medications beyond laxatives, and a special diet. Alternatively, it involves incontinence to solids and/or liquids 2 or more times per week, necessitating pad usage 2 or more times weekly. 30% rating. Moderate loss of sphincter control, where incontinence or retention is fully managed by a physician-prescribed bowel program. This condition requires digital stimulation, medications beyond laxatives, and a special diet. Alternatively, it involves incontinence to solids and/or liquids 2 or more times per month, necessitating pad usage 2 or more times monthly. 10% rating. Mild loss of sphincter control, with incontinence or retention fully managed by a physician-prescribed bowel program. This situation necessitates medication or a special diet. Alternatively, it involves incontinence to solids and/or liquids at least once every 6 months, requiring pad usage at least once every 6 months. 0% rating. A history of sphincter control loss, currently asymptomatic. Note: complete or partial loss of sphincter control refers to the inability to retain or expel stool at an appropriate time and place. Rectum and anus, stricture of, diagnostic code 7333. This condition involves the narrowing of the rectal or anal canal, causing difficulty in passing stool, pain, and potential complications like infection. Treatment may include dilation, medication, or surgery to restore normal function. It can result in the inability to open the anus and expel solid feces, warranting a 100% rating. A reduction of the lumen by 50% or more, causing pain and straining during defecation, is rated at 60%. A reduction by less than 50% with straining is rated at 30%. Luminal narrowing managed by dietary intervention is rated at 10%. Note: conditions under this code encompass dysenergic defecation, involving the levator ani and anismus, also known as functional constipation. Ostomy evaluations should follow the guidelines for large intestine resection, DC 7329. Rectum. Prolapse of, diagnostic code 7334. Rectal prolapse occurs when the rectum slips through the anus, causing discomfort and difficulty with bowel movements. Symptoms include pain, bleeding, and incontinence. It often requires surgical correction for effective treatment and relief. Persistent, irreducible prolapse, repairable or unrepairable. 100% rating. Manually reducible prolapse, not repairable, occurs outside of bowel movements, exertion, or Valsalva maneuver. 50% rating. Manually reducible prolapse, not repairable, occurs only after bowel movements, exertion, or Valsalva maneuver. 30% rating. Spontaneously reducible prolapse, not repairable. 10% rating. Note: following repairable rectal prolapse, maintain a 100% evaluation for 2 months post-repair. Afterward, Assess residual effects through a VA examination as per 3.105. Any changes in evaluation will be based on this examination. If sphincter control impairment is the main disability, evaluate under Diagnostic Code 7332, rectum and anus, impairment of sphincter control. Ano, fistula in, including anorectal fistula and anorectal abscess, Diagnostic Code 7335. This condition involves abnormal tunnels between the anal canal or rectum and the skin surface, often accompanied by painful abscesses. Ratings vary based on the number and severity of fistulas. More than 2 constant or near constant fistulas with abscesses, drainage, and pain rate at 60% rating. 1 or 2 simultaneous fistulas with abscesses, drainage, and pain at 40% rating. 2 or more simultaneous fistulas with drainage and pain, but without abscesses at 20% rating. And 1 fistula with drainage and pain, but without abscess at 10% rating. Hemorrhoids, external or internal. Diagnostic Code 7336. Hemorrhoids are swollen veins in the rectal or anal area. Internal hemorrhoids occur inside the rectum, while external hemorrhoids develop outside the anus. Symptoms include pain, itching, and bleeding during bowel movements. Severity determines VA ratings, ranging from 10% rating for occasional thrombosis to 20% rating for persistent bleeding or prolapse requiring treatment. Pruritus ani, anal itching. Diagnostic Code 7337. This condition is characterized by persistent itching around the anus, often causing discomfort and irritation. It may result from various causes like skin conditions, infections, or allergies. With bleeding or excoriation due to scratching, it warrants a 10% VA rating. Without bleeding or excoriation, it is rated at 0%. Treatment involves addressing underlying causes and managing symptoms for relief. Thank you for watching this video. Please don't forget to subscribe and like our videos.